Hi, my name is Courtney Smith, and I will be presenting my behavior change project on a 5-year-old female named Jane Doe. Now, Jane has been diagnosed with autism spectrum disorder. Jane is nonverbal and has not attended school. She has attended ABA clinics off and on since age 2, and she has been attending my ABA clinic since September 2015. Jane comes to our clinic 5 days per week, 6 hours per day, so she's getting about 30 hours of ABA per week. And she presents with multiple behaviors, but the target behavior for this project is tantrum behavior. Now, Jane's tantrum behavior is defined as screaming and crying for at least 5 seconds and may include kicking, scratching, and hair pulling. The onset criteria for this behavior is screaming and crying for at least 5 seconds, and the offset criteria is a calm body and a quiet voice for at least 30 seconds. The measurement technique we used for this behavior was duration. Now, the reason why we use duration data is so we can accurately show how long a time that Jane is tantruming, whereas if frequency data was used, it may only show 1 to 2 tantrums per day, but duration can show that these behaviors last 45 to 50 minutes, and if the intervention is successful, we can show how much time each tantrum can be reduced by. We used an A-B design in this project. The A phase was baseline, and in the baseline phase, we just ran Jane's ABA sessions as normal. Now, if tantrum behavior occurred during ABA sessions, the SD just continued to be delivered as normal, and basically work just kept happening through the tantrum. If tantrum behavior occurred during a free time or break time, the behavior was ignored. Now, the intervention phase was a little bit more complicated, so we used what we called a communication board, and it had pictures of her most preferred items, as well as a picture of the sign for break, which is this. And the reason we had preferred items and break is because a functional behavior assessment was conducted prior to the start of the study and determined the function of her tantrum behavior was access to tangible and escape. So we wanted to make sure that we were meeting the function of the behavior, as you know, functional communication training targets the function. And so those pictures were used, and what happened is if tantrum behavior occurred, Jane was prompted to use the communication board to pick the picture off and hand it to the teacher. Now, at the beginning of the study, all we required was her to pick the picture off of the board, and she was given the reinforcement as requested, or the item she requested. In addition to this happening during the behavior, the functional communication training program was ran at least 1 time per ABA session, so that was still occurring, and that teaching was still happening regardless of behavior. Inter-observer agreement data was collected throughout the study, and this ranged from 90.3% fidelity to 98.4% fidelity. So that was really great. We were really happy to see those results as far as IOA. The results of the study were really promising. We did see a significant reduction in Jane's tantrum behavior. I would like to show you this graph to help you understand the results. So this initial picture is of the baseline phase, and you can see that during this phase, Jane's tantrums ranged from about 30 minutes per session to 45 minutes per session. I would like to mention that each session of the study was 3 hours. In the next phase, the functional communication training phase, these first 2 sessions that were run were still pretty high. However, we saw a significant drop on the 3rd day, showing how effective the communication board was. In the reversal to baseline phase, we saw a slight jump in the data, but nothing as high as that initial baseline phase. So we suspect that learning occurred during this functional communication phase, so that when we did do the reversal to baseline, although the functional communication training was not occurring, she was still using the board to communicate with us. And during this last phase, we saw pretty consistent with the second phase, with a slight spike at the end. I just want to hold that up to make sure that you guys can see it okay. Now, I would like to discuss the results a little bit. So, although we saw really promising results and we were very pleased, we do not feel like the treatment is complete. The reason being is, even though we saw significant reduction, there was still an average of 15 to 20 minutes of tantrum behavior per session. So we would like to get that down to an even more manageable level. In addition, Jane was not independently using her communication board. Prompting was still needed throughout the study. So the goal will be to reduce the duration of tantrum behavior to less than 5 minutes per session, and teach Jane to use that communication board independently. After that is mastered, then we can move on to teaching generalization and doing maintenance of the program. But during this phase of the study, generalization was not taught. In addition to that, I would like to add that we would also like to teach her parents how to use the communication board at home to help generalize even more, because the duration of, this study was conducted completely in our ABA clinic and has not been generalized to her home yet. Overall, we were really pleased with the results, and we look forward to continuing teaching Jane functional communication to help with this tantrum behavior. Thank you so much.